Well, let's go ahead, and it looks like most folks have logged in or slowing down. Let's go ahead and get started. I'm Steve Mondrenach. I'm the Executive Director of the Association of Food and Drug Officials. We're so excited to have you all with us today for our second State Retail Food Program Manager Quarterly Call, our third. God, I can't believe it.
Second.
I was like, they blend together so quickly. Second call. We're very excited that you've joined us once again. We're going to start with Lori Farmer, who is the Director of Office of State Cooperative Programs. And welcome, Lori.
Thank you. And thanks for the opportunity, Steve and Elizabeth, to be here today. I'm so passionate about what you guys are going to be talking about today. And you have a panel of experts, like really people that are going to knock it out of the park today. So I'm so excited to hear what they're doing in the area of risk-based inspections. In FDA, modernization of our standardization procedures is something that we will be undertaking as part of our operational plan moving forward, and better incorporating risk-based inspection methods will be a critical piece of that. We absolutely want to emphasize that more in standardization procedures, because what is it that we're about? What are we doing here? It's all about the prevention of foodborne illness risk factors at retail. So in the industry, and how are we doing that? We're assessing risk. So that's so important. So I just want to let you know, we're in the early stages of looking at that in the agency. And it's something I'm very passionate about. In addition, AFTO is part of the Retail Regulatory Association Collaborative, and they have a risk-based inspection assessment as part of the work they are doing that also aligns with the new era for smarter food safety. So this includes an assessment of barriers to conducting risk-based inspections, and NACCHO and CFP are doing that. And then AFTO, of course, is identifying opportunities for the root cause analysis and risk-based inspection. So really appreciate championing that. Those projects will hopefully yield significant information that can help us learn about states, locals, tribes, and territories' needs and barriers, and improving accordingly. So I look forward to listening to the distinguished panel today, and thank you for the time.
Well, thanks again, Lori. And we're very excited once again to continue our cooperative work with the Office of State Cooperative Programs. And welcome to your new team member. Do you want to just mention that, Andres, while you're here? I know he's not with us today, but do you want to mention that to everyone? Oh, you're on mute, I think.
There. Recently, an external hire was selected for our retail division director over operations for retail. So responsible for all field operations in retail. The branch directors report to this person. Andre Pierce was selected. He is from Wake County. He has had executive leadership in that state and in that county for 15 years. He's very metrics-based focus and talking about outcomes, public health outcomes, and what we're trying to accomplish through the standards. So he's very focused on that. I'm looking forward to his change management leadership in us moving forward as a national retail food community. And so I see him as being able to champion these efforts with our stakeholder community. And I'm just looking forward to it. And he's actually in an all-day training. So he's getting what I call the FDA dip today. I wanted him to be able to be here today, but I'm just really excited about him joining the agency. And I know that you will be seeing him soon.
Yeah, well, once again, we're very excited to have Andre in that position, and that position has been added to your office. We see that as a great thing. With that, let's go ahead and move on to the next slide, please. There's a handful of things that we just wanted to remind you all about. Once again, if you do have any needs for FDA OTED training, the sooner you register, the more likely you are to get those seats. That gives you a link to the site where all of the course registration materials are included. This is all of the courses that will be offered through September 30, 2022. So once again, if you need any of these courses, so that would include things like risk-based inspection, special processes at retail, and et cetera. All of those sorts of retail-centric courses, the full list, no matter who's delivering them, are available there, and all of those courses this year, or virtual courses this year. So please go ahead and take a look and get those, get your signups done, because once they're full, there are no additional seats available until after September 30. Okay, let's move to the next slide. We wanted to also remind everyone that we, after having full classes and wait list for the root cause analysis for retail food safety course, we have made available additional courses both in the spring and in the fall of next year, and those registrations are now available. So go ahead and take a look if you're interested. These are very, very small group courses, about 18 students per course, and really interactive, in a half day over 4 days for each course, so 16 hours of delivery. So if you're interested in learning any more, don't hesitate to reach out to Elizabeth Nutt on our staff to learn more, but there are additional courses available now for if anyone's interested. Let's move on to the next slide. We just wanted to make available, many of you are familiar with Ben Chapman's and North Carolina State's Retail HACCP Validation and Verification course. We do have a few of those coming up that will be virtual courses in March 17th and March 24th. Those are available if you're an AFTO member, 2022 AFTO member. There's a $25 cost, or $200 for non-AFTO members. So if anyone's interested, the registration for that is going to be dropped here any day, I think next week, if I recall correctly, but those are coming up, and we just wanted you to have that on your radar screen if anyone has a need for those two courses. You'll note that one of them is a little later in the day to accommodate some of our folks that are further west and with later time zones. So let's move on to the next item that we just kind of next reminder item. One other thing to note, environmental sampling courses are available for environmental sampling at retail. If anyone has a need for those courses, drop us an email. We have some options available. We do have some funding to bring those out to your location. So if anyone is interested or would be interested in hosting folks in a regionally based course, we'd be very interested in talking to you. I know we have one state that's expressed interest thus far, but if anyone else is interested, please let us know. And once again, you can reach out to either Elizabeth or afto@afto.org. And then almost the end of our reminder list for today. The next slide, please, Amy. We did want to mention there's some new wild mushroom guidance document that's available that was we completed in conjunction with the Mycological Society, et cetera, that has additional identification information along with information about the various types of wild mushrooms to be of assistance to the regulatory programs and provide a reference. So if you haven't taken a look at that, please go ahead and take a look at that. That's something that was just released near the end of the year. Let's move on to the next slide. One other thing you will be seeing announced, actually, I think the save the dates went out this week, is an inspector boot camp, which will be a virtual course that has both a retail and a manufactured food component along with soft skills component. This has been designed by those folks that are the boots on the ground inspectors, identifying the areas that they thought were important to make them better, along with a lot of surveying of inspectors out there to learn about what their needs were. So some of the things you'll see included are risk-based inspection approaches, leveraging evidence to support the writing of accurate and valid reports, identifying special processes in the review of food safety plans, improving operator interviewing skills, and identifying the difference between aggression versus violence and how to de-escalate are some of the topics. That will be offered in 2 sessions, a morning and afternoon session on each of the dates you see below. We are pleased to announce that there will not be a cost for that. And we're bringing in some first-rate external speakers to participate, particularly in the soft skills portion. We will note, though, this is really meant for the boots on the ground, the actual inspector level. And along with that, there will only be a total of about 950 seats available between the 2 sections, about 400 and some 450 or 475 per section. So when that sign up does come out, if you are interested, go ahead. There will also be NEHA hours associated with it. So please go ahead and get anyone interested registered early, and it will be a really great event. So we're very excited about that coming up. And with that, one last thing to put on your calendar, if you don't already have it on your calendar, I will officially tell you, absent something dramatically changing, the AFTO 126th Annual Educational Conference will be June 11th through the 15th at the Renaissance Phoenix Glendale Hotel in Phoenix area. That we're pretty excited about the program. There's going to be some great workshops. For example, if you happen to be a new program manager, there's a whole day-long session focused on being a new program manager. So that might be something for if you are new in your position, you might be interested in participating in. In addition, some great workshops related to storytelling and how to communicate important messages for your program, along with several other areas. But do go ahead and take a look. The registration and the agenda will be forthcoming about the 1st of February. So just wanted to make you aware, but get that on your calendar as that's coming up. With that, I'm going to turn it over to Elizabeth Nunt, the Retail Food Safety Director here at AFTO, to coordinate our presentations for today.
Very good. Thank you, Steve. And I appreciate everybody that's joined. I think I'm very excited about this topic, as Lori mentioned as well. So I did want to also show that we have some upcoming network calls in March, the risk factor studies. I'll probably be tapping some of you on the shoulder to help facilitate that particular course. So if you've done a risk factor study and you're interested in sharing that, let me know, or I may be giving you all a call or dropping you an email to see if you'd help me out with that call. The May 4th call, it says to be determined. I think we're going to be looking at HACCP special processes, but that's not in stone yet. So if anybody has any suggestions for topics, please send them my way, because I think these calls are important. It keeps us all connected and we can share and learn from each other. So with that, I will introduce our panel. Next slide, please. Yes, Mr. Joe Graham and is going to be speaking, and initially about the Joe is a inspector for the FD 218 course that many of you have probably taken. And then Ms. Kim Stryker will be speaking, and Deanna Copeland and Mark Speltz. I'm going to have each one of them. Joe, if you'll go first, just give us a little brief bio of yourself, and then we'll go from there. So Joe, do you want to start out first with your little intro?
I sure can. Yeah, good afternoon, everyone. I'm really excited to be here. As has already been mentioned, but love this topic, and I manage the state's food safety program in Washington State. I have been at the State Department of Health for about 20 years. And I've been I've worked at the local level, and I've also worked at the federal level in the Army as a preventive medicine specialist, which is similar to environmental health. And as Elizabeth mentioned, I do teach. I'm one of the cadre for the FD 218 risk-based inspections course.
And how long have y'all been doing risk-based inspections there in Washington? Joe, do you know?
It's several, for many, probably 10 years or so,
good.
probably.
Very good. Very good. Kim, would you like to introduce yourself, please? Kim Stryker with Alaska.
Good morning, everyone. I'm Kim Stryker. I'm from the state of Alaska, and I manage the food safety and sanitation program here. We provide direct services throughout the state, with the exception of the municipality of Anchorage. My program entails everything from mollusk and shellfish to food processing and everything in between. We also do body art and pools and spas. I've got a program of about 30 total, and about 13 of those people perform. They have what I would consider a full workload of facilities. We've got about 4,500 facilities statewide. About a quarter of them are not on the road system, and they encompass an area. Alaska is about 20% of the lower 48 states. So it's quite a large area. We've been on the road to implementing risk-focused inspections or risk-based inspections since, I would say, about 2002. So it's been a lot of years. I'm going on my 26th year with the program. And so it's been quite a long journey. I'm happy to be here to talk about it a little bit.
Very good. Deanna, would you like to go next, please, with Harris County, Texas?
Sure. Hello, everyone. I'm Deanna Copeland. I'm with Harris County Environmental Public Health. And if you don't know where Harris County is, I'm down in the Houston, Texas area. And we have a very large jurisdiction that we inspect. I mean, geographically, it's nothing compared to what Kim has, but we're still larger than some small states here just within our county. We service about 4.5 million people in our area, and we have a little over 9,000 food establishments that we regulate. I do so with 36 field inspectors, and when we're fully staffed, of course. And I've been in this position, I'm not gonna say in this position. I've been with the food safety program for over 23 years, and I've been managing the program for 7 years now.
Very good. Mark, how about you?
Hello, everyone. I'm Mark Speltz. I'm with the state of Iowa. Been with the state of Iowa here for almost 23 years at this point. Was an inspector and am now the program manager for the state agency. A little bit about our state and about our program. We cover 63 of the 99 counties direct. So we have direct authority for food establishments. We have authority for food processing plants in all 99 counties. We do contract with 12 local health agencies to under a delegation agreement to actually provide services in the other 33. I have 21 food safety specialists or inspectors with that have retail inspection responsibilities, a couple of supervisors that are field-based, and also a program lead. As far as inventory, we're approximately 11,000 food establishments. And then, you know, as far as risk-based inspections, I think much like Kim, we've kind of been moving towards that, you know, since like 2000, 2002, but we really didn't formally bring risk-based inspection methods and expectations really formally got placed in 2013. That's really when we really started the more kind of formalized effort with providing training, et cetera. So.
Great. Thank you, Mark. So appreciate it, and a lot of experience here on the panel. So we're going to start out with Joe. Joe's going to be presenting kind of an overview of what a risk-based inspection is. As an instructor with FD 218, that if any of y'all have taken that course, you know it's awesome. At least I think it is. But if you haven't taken it, I encourage you to sign up, because it really does open your eyes to a new way of looking at risk factors and working with management. So Joe, I'll let you go ahead and start.
All right, thanks, Elizabeth. Yeah, so we want to start this out with a description of a risk-based inspection. And I think that risk-based inspections mean different things to different people. So hopefully we can come to some common agreement about what a risk-based inspection is. And a risk-based inspection is absolutely a routine inspection. Sometimes people hear the term routine inspection and risk-based and think they're different. A risk-based inspection is a routine inspection, but it's one that is focused on risk. There are specific elements included to help inspectors be more efficient and effective. And that's really the mantra of a risk-based inspection. That's why we do them, is to help our inspectors be more efficient and their valuable time. Time is valuable when doing inspections. We would like the inspectors to spend most of that valuable time on the things that actually result in foodborne disease, and helping them to be effective and actually finding the risk factors, identifying properly the risk factors, getting the corrective actions, and doing those things to ultimately, like I said, the goal being to reduce the risk of foodborne disease in our communities. To have a risk-based inspection program, there are some prerequisites, some things that need to be in place. First of all, a jurisdiction should have, or agency should have, their food establishments grouped by risk. That's covered in the annexes of the FDA Food Code and how to do that, but there needs to be a risk-based designation for food establishments. All the staff need to have proper equipment. If we don't have, thin tip probes to get all the types of foods that are going to be observed cooking and cooling and others, or we don't have the proper training on that equipment as well, how to properly use thermometers, how to properly use test strips, so that trained staff, also training the staff to be able to properly identify what the risk factors are and to make correct observations. Those are important prerequisites for a risk-based inspection. Also having adequate resources, making sure there's sufficient budget, sufficient staffing, that the staff have the support of policies and procedures that are in place to support them when they're doing those risk-based inspections. And then also just generally, I have the word support there just as a general supporting the concept of risk-based inspections, helping the inspectors and the staff understand that management support the efforts to incorporate very deliberate protocols, very deliberate elements into the inspection program to make it a risk-based inspection program. Next slide, please. So as part of a risk-based inspection, this really goes into a little bit more of the kind of the meat and potatoes of a risk-based inspection. So first is to prioritize, prepare for the inspection. That preparation would involve reviewing past inspection reports and also before going into the facility, also reviewing the menu. Both of those can be done before going into the facility, especially now when we're trying to reduce the amount of time that staff are physically inside a given food establishment. These things can be done. Almost every restaurant now, every food establishment has their menu online. And so these things can be done prior to actually initiating the inspection to get an idea of what's been observed in the past, what might I be able to expect when I go into the facility, and then also, of course, what menus and what menu items and what processes may be going on when I enter that facility. We believe strongly in prioritizing the inspection. We do understand, again, it's hard to get all the inspections done in a given time. Time management can be a real struggle for inspectors. So we want to make sure that their time is prioritized. And one tool that we teach them is what's called a quick walkthrough. It's where, after washing hands and talking to the person in charge for a couple minutes, walk through the facility. It's quick. The word quick is deliberate. It is a quick walkthrough, and it's used to determine what is my inspection flow going to be? What are the most important things that I need to focus on in the first few minutes of my inspection once I complete the quick walkthrough? They're trying to identify things that are static that maybe they can come back to later and observe later on in the inspection versus those things that are dynamic going on right now. Examples of dynamic would be staff washing their hands, directly handling ready to eat food, cooking food. Static, might be food in the walk-in refrigerator, for example, would be something that's static. Food that's been on out on a salad bar for an hour already or so. Those are static. Those aren't going anywhere during your inspection. But some of the things are dynamic and need to be observed quickly, or you won't be able to get them. Cooking can be fleeting. Handling ready-to-eat food could be fleeting. So I want to get those things observed as quick as possible. Also, looking at relative risk. What am I seeing as I go through this walkthrough that's the most important that I'm going to need to spend my time on when I am done with that quick walkthrough? And then what needed information am I going to have in order to assess whether something is a risk factor? With cooling, for example, often we need several temperatures of cooling food. And so what am I going to need to go back and make sure I get temperatures of as I start my inspection and determine my flow? So we teach them how to put all that together and then to get that inspection prioritized to really focus on the most riskiest procedures. And during a quick walkthrough, we also emphasize that there are times when they might need to grab a quick temperature during that quick walkthrough, or maybe even do an intervention. If there is someone observed, handling sushi that's ready to eat with their bare hands, that's going to be something we don't want them to necessarily wait until they're all done with a quick walkthrough and go back, because that activity could be done. So those are some things that we teach them about prioritizing the inspection. Next slide, please. So some general principles of a risk-based inspection, of course, are identifying the foodborne illness risk factors. We really focus and hone in on those risk factors that cause foodborne illness. It's very important that inspectors are able to correctly evaluate what actually is a violation, what is actually a risk. Also, effective communication. We really teach a lot about questions. Ask questions. It's very important that our inspectors are constantly asking questions. Where was the food before this particular observation was made? Where is it going next? Getting an idea of the processes through questions, and talking about employee health policies, or some things that really can only be assessed by asking questions. When was this food put in here? When was this reheating process started? Asking questions throughout the inspection is really important, and to be able to do that in a way that understanding is happening and communication actually is effectively happening. So we spend some time on that. That's an important element of a risk-based inspection. The ability to get on-site correction. That's kind of an art in itself, to properly get that correction that needs to be done. I mentioned earlier, policies and procedures, the importance of those. Those are important when we're talking about on-site correction, whether it be having to destroy food, for example. And then once the on-site correction is in place, making sure there's long-term compliance. We really focus on the importance of active managerial control in a risk-based inspection, making sure that knowing that the inspector is only there for a very, very limited amount of time, and be able to set up the manager to actively manage the risks when an inspection isn't happening, which is most of the time. So the active managerial control is really important to a risk-based inspection, and to be able to evaluate that and be able to set up the manager to properly have active managerial control long-term. Next slide, please. So management definitely has a role, and I know that our panelists will talk about some of this as we go on, but providing resources to staff is really important. Making sure they are properly trained at the beginning of their careers, making sure they have that continuing education throughout their careers. They go to such courses, as Steve mentioned. He gave a whole laundry list at the beginning of this presentation about all the opportunities the staff have, and now a lot of the opportunities are virtual, and so they can do them from the comfort of the office or their homes. Giving them that support and really emphasizing that we are a risk-based, we have a risk-based inspection program. We use risk-based principles, and I think standardization is important too. I know Lori mentioned that, and standardization, even right now, the FDA standardization isn't as super focused on as risk-based, but I think that's going to change, as Lori mentioned. And also, we can even standardize to risk-based inspection protocols outside of the program standards within our own teams, and making sure that all the staff understand these principles and are using those in inspections. And really emphasizing that risk-based inspection program through staff meetings. When we teach an FD 218 course, we give a lot of exercises. We have a lot of breakout rooms we go into virtually, and we have a lot of small group discussions. We encourage staff to take those back and modify them, use them in staff meetings, share them with you as the managers, and help them understand there are tools that can be used on an ongoing basis to really practice the principles and to apply them kind of outside of an inspection, talk about how it's going with the risk-based strategies that are being used. So those are an important part of emphasizing that. And then also important is reviewing and evaluating the inspection reports. As managers, we can tell from the inspections if an inspector is being risk-based. We need to have those conversations with them. If we're seeing a lot of, if we're using the model inspection form with in, out, NA and NO, not applicable, not observed. If we're seeing a whole bunch of not observed for cooking in like, let's say we review some inspection reports of one facility over a period of time, and there's a lot of not observed, you need to have a discussion with, you need to get in there at a different time to make sure you've actually seen cooking and those types of things. So those inspection reports and the reviews of those are an important component of helping our staff be risk-based. Next slide, please. And so we are hoping that risk-based food safety inspections become the norm. I mentioned that routine inspections at the beginning, and how a risk-based inspection is a routine inspection that's based on these principles I talked about, with, again, the ultimate goal of being having our inspectors be more effective and more efficient, and ultimately, of course, reducing the risk of foodborne disease in our communities. There are resources out there to help you. The FD 218 course itself is a resource to send your staff to. But again, I really want to emphasize the importance of following up locally. When we train staff, we hope they bring these back and share them with other staff, share them with you, the managers, and incorporate some of these exercises and different viewpoints into the class. Into your programs. The 2017 FDA Food Code Annex 5 is about risk-based inspections. I took a lot of these principles from that. So that's important. That's something we hope every inspector reads and understands those principles. And then, of course, other resources are us, fellow managers, today's panelists, for example. We are resources to you as well. So as you work to be more risk-based, we want to help you in that and share some of our lessons learned. And a couple of things that I always think about when we teach the class and things that we want you to know is that we always stress to them too the importance of following local policies and procedures. They have a lot of questions for us. We get lots of questions during this course. We answer the questions. We are very much in line with FDA and CIF standard part of FDA. So we give them really what I'd say the FDA answer. And we think those are great answers, but we also tell them to make sure they talk to you, the managers, about local policies and procedures so they're not conflicting with any of those. And also want to help you understand that we really are helping them. We're trying to get them focused on the high risk factors, those risk factors that lead to foodborne disease. We're not telling them not to observe the good retail practices, but we are emphasizing not to spend time looking at the good retail practices. Those things are going to be found in the course of inspection. The things about a dirty wall, missing floor tiles, those things are going to be seen during the course of your inspection while evaluating the high risk factors. What we want is that valuable time spent on focused, we want that valuable time focused on the high risk factors and not seeking and spending time looking for the good retail practices, because we believe those will be found anyway, and they don't need to be, we don't need to have inspectors on the floor looking under refrigerators, spending an inordinate amount of time in the dry storage rooms. We really want them trying to get them focused on those risk factors that will most likely lead to foodborne disease. So that's an overview of risk-based inspections. Hopefully that sets a foundation for the rest of the conversation. And I'll turn it back over to you, Elizabeth.
Thank you, Joe. That was very good, very good. A brief synopsis of what we think is a risk-based inspection. So we're going to move into the questions for our panelists, and I'll just let you know that these were questions that between myself and the panelists we thought were going to be beneficial to you. If you all have specific questions or something that's not clear, you want additional information, if you would please just drop your question in the chat box. And if you have a particular panelist that you would like to address the question, you can put that in there too, or we can just assign the question. But we think these questions kind of cover a lot of the program or the philosophy of a risk-based inspection program. So if you have additional questions, just please put it in the chat and we will try to get to those if time allows. If not, you can always send me an email, drop me an email, and I can try to find out something for you. I also wanted to mention that Dave Lawrence with Fairfax County was supposed to be on our panel this morning or this afternoon, but because of weather, he was trapped at home and he was not able to make it. But I think with Deanna and Kim and Mark, we're going to have a great, and Joe, if he wants to chime in as well, we're going to have a great resources here to answer some of these questions. So Amy, if you'll move to the next slide. So our first question is kind of getting started. That's always the hard part. How do you start? And a lot of you have started this many years ago. Maybe you'll have to go back into your memory cells there, but I'll start with you, Kim. How did you start a risk base? What steps did you take to sell that program to your team? Because it is kind of a change of philosophy.
Thanks, Elizabeth. So I would say that the impetus was we took a really significant cut to our program. And at the same time, we knew we needed to take a different approach and make the most of what we had left. So we, over a series of meetings that we had with staff and working groups and that type of thing, we started discussing a risk-based approach. At that time, we called it active managerial control, and people got the impression it was something that the program did. They didn't quite make that connection. It's not what the program's doing, it's something that the operators are doing to maintain control over risk factors. But it was a very slow process. But one of the first things that we did was we wanted to train people as to what a risk-based approach was. I participated in a training as a narrator, but all the staff were required to take that training. So that was kind of the first step. But I will tell you, we had some pioneers who really embraced the idea, and we had some others who weren't so wild about it. And it's taken us a long time to shift the focus. It takes a while for a program to change attitudes and mental models. So Um, I would say, we had a lot of other steps that we took, kind of mechanical steps, but changing that culture was really tough for us.
Just took some time, I would imagine. Yeah. Deanna, did you have a similar experience, or how did you all get that incorporated into your process?
I'm going to echo a lot of what Kim said, but it is a process. It's not something that you can just be like, all right, we're going to do risk-based inspections, because your staff have, their own experiences and their own history with establishments, and they also have their own history in your program. So we started the process, I'm going to say back in around 2005, when we went to the inspection report that used in, out, NO, and NA. And they started to teach us, when to mark NO, when to mark NA, what the importance was. But that's something that we're still harping on, years later. We are still reinforcing that constantly with our staff, in trying to emphasize how each one of these are a training opportunity when you're doing your inspection, because just marking something out isn't always going to get the message across that what the implications are of this staying out. And, as supervisors and managers, also using that information to review the inspection reports, and then go back and do little teachable moments with our own staff that, you're in a full service restaurant and you're telling me all of these things aren't applicable. Well, that can't possibly be the case if we have this place categorized right. So that careful review, that's something that can go on and on, I think, indefinitely, as part of just your own process improvement. We have a saying in our department that we don't do things because that's the way we've always done them. That's just an unacceptable answer. You're going to stagnate, and you're not going to be making any improvements or any progress if you continue to do things the way you've always done them. So we remind them change isn't easy. But just because we've always done it that way doesn't make it the right way. And we can always be more effective at what we're doing.
Very good. Thank you for that. Mark, did you have anything additional to add?
Not really additional. I think they both covered the ground really well. I will tell you that, at least in our experience, that, to sell this philosophy, so to speak, to our team, the philosophy wasn't a hard sell, to be honest. I think, it makes public health sense to focus on the riskier behaviors, and I think focusing on that as opposed to what I would call code enforcement, I think make it a ton of sense to all of our staff initially. But I think the challenge was moving from idea to institutional. And that's where, we really had to take a more methodical approach, and it was going to take a long time. So, once the idea itself, I think, just makes sense to people, and there wasn't a lot of buy-in we had to get there. But it was really changing behavior, going from, kind of the code enforcement inspection to that risk-based inspection and everything that it entails. So,
very good. Well, I'll start with you, Mark, on the next question. The retail program standards have a lot of connection with risk-based inspections. It's been mentioned that standard 3, which is HACCP principles, standard 4 is kind of your overview of your staff. Standard 6, of course, is compliance and enforcement. And then, of course, standard 8 is, do you have the resources? So with standard 4, how did you incorporate risk-based using standard 4? We'll start with that one with you, Mark.
No, great, thanks. I really view standard 4 as key to the whole process of really implementation. So, you have risk-based inspection methodology. In order to maintain that, you need to make sure that you're implementing. So we use standard 4 to reinforce, to assess both individually and programmatically, as where we are with risk-based inspection. So early on, we used our QA, or uniform inspection program, to not only look at the 10 quality elements and then later on the 20 quality elements, we also looked at key risk-based inspection performance elements during our joint inspections as well as our file reviews that we do as part of our QA. So
Yeah. Mhm.
although standard 4 now does contain, a risk-based inspection quality element, one of the
Mhm.
20, and other things that certainly are support risk-based inspection, we still even look deeper. Some of those key things that that were pointed out, that Joe pointed out at the beginning, those principles, are we doing those types of things? So we have things on our joint inspection assessment, like did the inspector verify control measures are in place for all risk factors?
Mhm.
Did they do that initial walkthrough? Did they prioritize those activities? Did they spend the majority of time focused on the risky behaviors? Did they assess the level of AMC? Those are all things that we look for in our quality assurance program, in addition to those 20 quality elements. So that's
Great.
really helped really reinforce um, um, our risk-based inspections. We provide the training, they set the
Mhm.
expectations, but if we don't look at it, are we actually doing it and look
Yeah.
for it? That reinforcement is such a important part of the behavior change and of any process as well. So.
Good, good. And Kim, I'll ask you, do you have, with program standard 3, which is probably one of the bigger standards that really focuses on risk-based, how did you all incorporate that into your process?
So, a lot of standard 3 is really about identifying your inventory. Like Joe mentioned, you want to make sure that you are doing these risk assessments on the facility and properly categorizing them and prioritizing them. And I would say that's a little different. You can categorize, you also need to prioritize based on those categories, and developing those solid policies and procedures are really important, but not just important like you stick them on the shelf important. I can kind of like this, for those of you who may be familiar with HACCP concepts or applied HACCP, which is active managerial control, it really is, you develop your policies and procedures, you train on them, but then as Mark said, you also have to verify and reinforce. Otherwise they end up being things on the shelf that no one looks at, no one cares about.
And Deanna, would you like to address standard 6? That's always the fun one, the compliance and enforcement. Or I guess it's fun. Maybe it's not fun. Anyway, I'll let you handle that one.
It's fun in the aspect that you can actually see how well your SOPs are being followed. I mean, I'm going to echo a lot of what Mark and Kim just said, that the creation of the SOPs, the creation of all the policies and the methodologies that you're using and that you expect your staff to use, they're great to have in place, but to use them, and not only use them, but use them consistently for all staff, especially when you have the higher risk establishments. We lean on standard 6 a lot just for the risk-based inspections, because we want to make sure that we are capturing those places that really should be taking our enforcement time. And if their risk is higher and they consistently have more risk factors out repeated over multiple inspections, well, obviously that's where our time should be. And we've tried to reflect that in our SOPs for standard 6. But being able to verify that's applied consistently, it's an ongoing challenge, but it definitely supports our risk-based inspection program.
Very good. And we'll move to the next slide, please. Next set of questions for the team. Okay, so I will start, Deanna, I will start with you again. So did you have to make any changes to your data collection tools or your software programs? I know that would be an expense maybe that comes along with implementing risk-based inspection.
So it does, but I think the expense is worth it when you look at the outcomes that you're trying to measure.
Good point.
We have over the years made lots of changes to our software and data collection tools to support risk-based inspections. We made some more drastic changes in 2015 when our state updated the food code, and we had to go from the old 27 item form to the 47 item form. That was a significant update to our data collection practices, but we took that as an opportunity to train more on the use of in, out, NO, and NA. We took away the default, you should say, answers.
Oh, right.
Now they
Mhm.
have to answer every question in, out, and out. So they are going to spend that time to think about their answer before they just try and check them all. We sort of made the inspection a little more difficult to fill out, but that was intentional because we don't want it to become an automated practice just to check the boxes as you go down. We want them to put that thought into it because they should be making that risk evaluation every time they're there.
Very good.
We have also taken this opportunity to include some questions that are part of a risk-based inspection, such as capturing some answers from our initial interview, so that we can start to correlate, when do people answer yes that they're cooking, to times of day that inspections are conducted. We ask questions about the processes. I mean, these are questions that they should be asking anyway with their initial interview when they do their walkthrough. But now we have the ability to capture some of those demonstration of knowledge questions to see where knowledge, they may have a certificate on the wall, but the person in charge doesn't necessarily, we see these gaps in routine places based on the answers we get. And we also ask about ill staff and how the establishments handle that. And we're excited that those data points are going to make our risk-based inspections better as we compile the data.
Yeah, yeah. Kim, did your program have to make any alterations when you incorporated it?
We did. And with the latest software that we began using, it's USA Food Safety, we felt like that really pushed us into an area where we could really start not just capturing the data, but actually trying to analyze the data and do something with it. And I think that it can be a sell, it can be an effort to convince the people with the purse strings to let a little bit go for an updated system. But when you talk about increased effectiveness and efficiencies, I think that is always an outcome of government generally. And you talk about the improvements to public health. It really helps you as a manager and your staff to be able to focus on the right things at the right places. Right. So I do think it's important. I think if you just absolutely can't get it, don't let that hold you back, but know that you've got a little bit of a handicap in terms of taking that data and pushing it forward. And I think the emphasis on the N out, NO, NA is important for data collection and for data analysis, because you can make a lot of assumptions when you don't necessarily have the indication that something wasn't observed or it never applied. Presuming that more is in compliance, more facilities are in compliance, it actually are. So I think it's really important for those people who might not be familiar with that concept. And that's a CFP form that's available. When Joe talked about the model form, that's a resource you can go to.
Very good. Yeah, I like the whole idea of, the data analysis helps you make the changes and improvements to your program as well. So Mark, I'll move on to the next question for you. How do you ensure that your field staff are actually doing risk-based inspections? What do you have in place for that? You mentioned that just a little bit earlier, but maybe a little bit more specifics.
Sure. So a lot of it revolves around things that we do with standard 4, but there's other pieces as well that have rolled into other standards and other things, but primarily doing joint inspections with them.
Oh, right.
Doing file reviews, routine file reviews. We try and do some of those on a quarterly basis. We don't always get there, but providing that feedback. And then we also look for, key data points. I think Joe mentioned and Kim also mentioned as well, as far as the software that we use that is helpful. Analyzing that data is so important to be able to maybe have certain KPIs or certain performance things that you're looking at. And we do find that there are a few that we believe are representative of implementation of risk-based inspection. So we go back to the number of not observed responses. We're looking at not only out of compliance, but how often are we marking not observed on things like cooling and reheating, where that those aren't just one observation kind of violations. Those are multiple observations are required. More verification discussions need to occur in order for that to be marked observed. So if we're seeing a high rate of not observed, that maybe means that we're not, that's a red flag for us, that
Right.
maybe that's not a risk-based inspection that was performing. So we do watch that item, and we do have some measurement there. A couple of other things that we look at is, compliance rates for certain code provisions, like the duties of the person in charge. Are there, if we see that moving up or down, we know that that is also a key indicator of risk-based inspections. I think we have some challenges in that area with, if we mark that, then what? So I think we're trying to overcome some of those types of roadblocks to, documenting some areas of active managerial control, but we do still look at that. So a combination of all that,
Yeah.
joint inspections, file performance evaluations,
Yes.
performance evaluations have risk-based inspection components in them.
Oh, wow.
When we look at, the inspections that we do, our inspection staff do, we review those for quality elements. And we do file reviews, and we reinforce that by including that in their, not only in their quality assurance program, but also in individual performance as well.
Very good. And I know, Kim, you were kind of passionate about this one when we talked. So what would you like to add to, how do you ensure that they're doing what you want them to do, what they're expected to do in the risk-based world?
Thank you. I think Mark absolutely hit it. And I think that he's really talking about sort of two things when you boil it down. He's talking about verifying that things are going on, looking at the data, making some assessments based on that. But then he's also talking a lot about coaching and reinforcing, and not just putting it out there that this is our policy, but you mention it consistently during staff meetings. You talk about it consistently. You reinforce it with performance evaluation or coaching. I think Joe hit on that. You have to embody that culture as a program. You can't necessarily put all your focus on bean counting and quantity when you really want higher quality.
Right.
You send those conflicting messages. So I think he really hit it. And if I were to sum it up, I would say coaching and verification activities.
Very good. And it's appearing to me that there's all these things are tying in: training, good software, data analytics, and program standards. So it's all kind of tying in.
And if I can comment on that, I mean, I think that what the standards work and what AMC and HACCP are all about is systems thinking. You're not thinking like you're checking a box off to get that standard met or to meet the requirement. What you're really doing is you're taking a whole look at what's going on, and you're trying to set it up so that you've got a system to keep the food safe. And we're asking that of operators, and we're asking that of ourselves.
Very good. So Deanna, I'll move to you on the next question. I believe that your program is fairly new. So what gaps or areas that you have you're still working on to improve to get in place with the risk-based process?
Well, there was always areas for improvement. And I think, once we start to have momentum in one area, well, then you have to add in other components. You can't, ignore the whole program and the whole risk-based inspection methodology. One of the things that we're still focusing on is management buy-in. And it's not that they don't support us in doing risk-based inspections, but they started to see our quantity of inspections are going down. However, we're catching more violations. We are marking more things on our inspection report. So it's this balance that, it may not look like you are meeting a higher number of inspections or completing a higher number of inspections, but you are having a more thorough inspection when you're out there. And that's, trying to ensure that they understand that we're focusing on the things that matter, and that does take more time. We're doing more on-site education. We're doing more active managerial control. handouts that we are going over at the end of each inspection, and that it's not necessarily going to be counted as in time of inspection, but it does contribute to us spending more time in each establishment.
Yes.
And that documentation, that's, I can't stress how to my staff how important that is, that you have to write down what you see, you have to write it down accurately, and you also have to make sure you're talking about what you're doing to make sure this problem is fixed in the future. And documenting that, yes, I am talking long-term control. It's not just something that we want to for you to do, but you have to put it on paper too, so that we can support the time that you're spending in the establishments.
Very good. Mark, are there any gaps that you're still working on to fill? Or I know, like you said, continuous improvement's always there, but anything specific kind of jump out at you?
I guess in my view, short answer is yes, we have gaps. Risk-based inspections are harder. They're more intensive. They take more time. So it's really easy for, if you're not have kind of constant vigil over this, that it's real easy to fall back into what I call the see in sight mentality. It's easier, it's less taxing. Not every inspector is going to have a great day every day. So you might catch a bad report here or there or something like, and maybe that one's not risk-based, but you have to try and identify, when it's more than just a one-off. So I think anytime the harder way is the right way, you're going to find gaps if you look for them. The difference, I guess, that we have now is since our methodology we really feel is institutionalized in our program, those gaps are more identifiable and the corrective actions are often standardized now. Where 10 years ago we were looking at this and we're trying to figure out what to do. Now we kind of know what to do and we kind of know where to look. So it's easier to kind of maintain that. But yeah, we definitely still have gaps.
Very good. So our next question is on the next slide, please. So this is an interesting question that I would like to find out if you all involved industry in any of this process, or did you have any pushback from industry when you tried to, because as Mark said, these inspections are a little bit more intense, they're a little bit longer. So I wondered if you had any feedback or pushback from industry and maybe what you did to overcome that. I'll start with, I guess I should pick somebody. Deanna, would you like to go, Deanna? Sorry.
Yes. So we haven't really involved industry as much, and I think that is something that we definitely can improve on. But we have received industry feedback, and it's not been very positive, what we've been receiving. We get calls often that are just your inspectors just standing there watching my staff. They're making them nervous, and we just, sort of reinforce, well, they're not there to make your staff nervous. They're there to do their job. And part of their job is observing what your staff are doing. So as long as your staff are doing what they should be doing, there's no reason for them to be nervous. And we've also had one, it was actually kind of a funny situation where a very well-known brand challenged us because they ended up in our enforcement process because they just scored well on every inspection, but they had the same cold hold violations out 3 times in a row. And therefore we initiated some enforcement action against them because they obviously weren't getting the message. They weren't heeding our warnings. They weren't trying to implement any control into this process. And they had their lawyer call us and ask us why we were citing them for something that happened 2 inspections ago. And it was just another point that we fell back on the risk-based inspection methodology and used it kind of as a teachable moment to let them know that if it's occurring repeatedly, that is indicative of a problem. So, we're going to be looking at your history, and your history is part of every inspection that we do. That's how we do all of our inspections.
Good. Kim, what about you? Did you all use any industry input, task force, or anything of that nature?
Well, particularly back in 2002, when we took this initial cut and we were really revamping our program, we had a very active food safety advisory committee. And they, of course, were immensely excited about this direction. They viewed it more as a collaborative approach. A lot of them liked the fact that we would schedule our inspections with them so that make sure the right people were there to talk with us and show us around. They didn't always like that we were scheduling time when they might be at their busiest, but a lot of times that's when you want to be there to observe what's going on. And we've explained that over time as well. So I would say, you know, there's a lot of perception among the public, among inspection staff, among management, among legislators, all of our stakeholders about what we do and how we do it. And so there's a lot of sort of PR that you really need to do to talk to them about why you're changing and why it's important and what they're going to get out of it from you. And so I think that overall, we have a much more collaborative approach. We do take enforcement when we need to, but typically it's not a punitive thing. It's more to help them get back on track. We might suspend their permit for a short amount of time while they have a chance to clean up. And then once, you know, everything is going, maybe we've had an office meeting to discuss, you know, how they can get back on track on a system, then we can help kind of get them back to where they need to be. But it's something that we don't use very often.
Okay, great. So I'm going to get to the last question so we have time to answer any other questions that the attendees might have. But I'll start with you, Mark. What lessons learned or best practices, just kind of in a nutshell, if I can say so myself, would you like to share with the group? We've got quite a few program managers online, and maybe some of them, this is brand new for them. And, you know, what can they avoid that you learn maybe the hard way?
Well, I mean, certainly there's some lessons learned in that I think all of us will be able to share here. So I'll just pick out a couple.
Sure.
I think be clear in your mind what a risk-based inspection is and what you're looking for as a program leader. It's not just focusing on risk factors interventions. It's more than that. So be very clear in your mind what that is and what you're looking at. You're really looking at verifying control of all risk factors during an inspection. It's gonna take longer. It will take longer. It also will trigger maybe more follow-up activities. So be prepared, have it clear in your mind, and also be prepared to justify and explain, as Deanna had said before, you know, why your number of inspections are lower. You know, we often get the you know, the inquiries about the widgets, and you know, these aren't widgets. We need to be able to talk to them, educated about what this process is. And I guess one of the other things I want to point out is, you know, find passionate people and empower them and encourage them to identify gaps in your process.
Yeah.
You can't do it alone. You need to have strong, passionate team members to be able to do this. And also, there are always gaps. If you don't expect to find them, you won't. So you should expect to find them, and you need to critically look at your program. Otherwise, you'll just confirm that you're doing great. You have to look hard.
Kim, what about you? What would you like to impart to the team here?
So I would say, don't get discouraged as a manager. This takes time. And as Deanna has said, it happens over time. It's not going to be an overnight thing. One of the things that I found was really useful was to call one of the inspection staff. And I was a peer at that time. I was not a program manager. And you ask them probing questions, but in a very non-judgmental way. And you listen for understanding. You don't listen to tell them why your idea is better, but figure out why they're not embracing it. What are some of the barriers that they perceive? So then you can those things. And it's really hard to do. For some people, it's easier than others. Not me. I had to have a sign in my office that said, listen to understand, or listen first to understand. So I would say be patient, focus on your pioneers, and really try and hear what your staff are trying to tell you so you can help them to overcome some of the barriers that they perceive.
Very good. Very good. Deanna, what can you share with us on some of your best practices or lessons learned?
I don't have much to add after what
Okay.
Kim and Mark said. Just be persistent and focus on training and training your staff and to consistent messaging. My staff don't, they say they already know my answer now whenever they come to me with a question. And my question is going to be, well, what's the foodborne illness risk? What's the FBI risk? And I'm not always going to tell them what I think they should do. I want them to work it out on their own because I think that's going to impact our program longer term. Just keep asking them, what's the FBI risk? You tell me, you know, what you're seeing, what's the risk, and how is it best fixed? Because that's at the bottom line, that's what's going to prevent foodborne illness.
Good. Yeah. Joe, did you want to add anything to that question at all?
No, I think they did a great job.
Okay. Well, I do have a couple of questions that I want to ask, and then we have a couple of questions from some of the attendees. So one question may have already been answered. Jamie, you asked this question. When you had hesitancy from your inspectors, you know, how did you overcome that? I know a lot of you talked about training and good communications, but is there any other area that you implemented to kind of sell to your inspectors that this was the way to go? And Deanna, I'll ask you that question. Or whoever wants to answer it. It doesn't, you know, who has a good answer? A lot of you have kind of addressed it, but yeah.
I'm going to sound like the broken record. It's training, you know, it's, we did have some older staff who were very focused on, like Mark has called it, the code enforcement inspections, the floors, walls, ceilings, the easy, obvious stuff, because that's what they'd looked at for 20 years. And those were the ones that I felt were much more resistant to adopting a new methodology because they were so comfortable in the way they'd been trained, the way they'd done it for so long. So yeah, we had a few that were a little more resistant, but eventually I think they came around once, you know, the light bulb started to go off and they were just that persistence and consistent training of this is going to prevent foodborne illness. That one, you know, dirty wall or that the back door being open, that's not necessarily going to make someone sick. So let's focus our activities. You know, we're not telling you to ignore that stuff. We're just saying focus on the stuff that really, really matters.
So another question, and I'll ask this of you, Mark. When you said you're starting out earlier in the call here, we talked about, you know, your facilities need to be ranked. And when you started your risk-based process, did some of those rankings change when you realized, hey, these places have a lot of risk factors or these places don't? Did you observe that when you were trying to implement your program?
So we've gone through, I guess, a couple of iterations of risk-based. We kind of started with the basic 3-tier model, high, medium, low. And then, you know, I think it was about 2010, 2011, we started looking at something a little more nuanced, and we eventually came up with something that is a 5-tier system. So we put a lot of thought into making those changes. You know, what we're really seeing here is we set a base frequency based on that inherent risk. So who they are, who they serve, what they serve, kind of that more static elements of the profile of that facility. We set a base inspection frequency, so that's part of it. But then we can adjust up or down based on other intrinsic factors, or you know, maybe more variable factors like inspection history, et cetera. So we kind of try and incorporate both. We give the flexibility to have that, you know, follow the base, but then we can change the frequency, maybe more frequent or less frequent based on what we're seeing. So I think we really try and incorporate all of that. So I don't know that we really looked at, hey, this type of facility, we're seeing lots of violations here. Maybe we should move them from a medium to a high.
Mhm.
I don't think that's really a discussion we had. We had, more along the lines of, is that facility and then their entire risk profile fits here, regardless of what their violation history is. And then we can then shift more frequent based on some of those individual performance areas, I guess.
Okay. Joe, did you want to address that as well?
Actually, I wanted to just go back real quick on the previous question because Jamie's question also asked about hesitancy from local health districts, and that's more
right.
more my experience because we are a
Yes.
home rule state or a local control state, and so it's
Mhm.
kind of the same answers. It's setting that tone at the state level for us. It's having that culture at the state level. We have created the forms. We have created the training. We do risk-based training.
Mhm.
But so it's that, and it's also finding, for lack of a better word, champions at the local level.
right.
Which program managers are most likely to use this, and can we get them to kind of peer-to-peer influence others,
Mhm.
and to bring them on board? And so for us, we're still in the process of this. We have, like I said, we have it set up at the state level, but we're still bringing health departments on.
Very
And
good.
trying to help them understand that this is really the best, kind of the best bang for their buck. It's in their
Mhm.
best interest to be effective,
Mhm.
but it does kind of, you do have to know I guess for us, we have to know the program managers and kind of what appeals to them. Is it the public health part of it that appeals to them? Is it the, is it the quality part of it that appeals to them? I mean, what we have to work on that a little bit and find those nuances. But it still really comes down to us setting that tone.
Yes.
And then adopting those principles ourselves and modeling that, and then continually keeping that in all of our training and all of the interactions that we have.
Very good. Okay, I have another question in the chat box from, I think it's Tracy. It says Weeks T. Anyway, so it was something that we discussed as a panel too about your staffing levels. Did those change? Did you have any issues with staffing? I think she mentioned that a lot of people think that you have to have more people to do a risk-based inspections or something of that nature. So, Kim, did you have any staffing? And I know Mark, you even said that you had some ups and downs with your staffing. Is staffing a key component to conducting an effective risk-based program?
Staffing is important to get the face time that you need with folks, but, and I think probably we're not out of line with what other programs see in terms of attrition. You've got retirements, you've got, things, people move out of state, they're sick of Alaska, or they, they figure out it's not the field they want to be in. So we are constantly hiring and rehiring. One of the challenges is I really encourage my staff to be able to take 215 or 218 rather. The class that Joe teaches. We've been very fortunate recently because it's online, but it was previously in person. And so we would invite our specialists up to Alaska because travel is difficult, and we'd travel everybody into the center of the state, really, or I guess the center of the population, and do that periodically. I think there's a real opportunity because of the increase in availability of coursework. Some of the courses that are being offered are phenomenal. So
yes,
I think it's a combination of just that technical training, because in order to be really effective, you need to sort of understand what a risk is and why it's a risk. It's also, there are some soft skills involved, being able to ask open-ended questions and have good communication, and that's sort of non-judgmental, and you're trying to pull that information out to really assess it. And thinking in a systems type environment so that you're trying to get to the root cause of something as opposed to just putting a band. So it is a constant challenge. And when you've got everybody trained up, then, 2 people leave or 3 people. I would say, it certainly affects your ability to conduct inspection work when you have fewer people, but when you focus on the quality, think about it at the end of the day, what does it really mean to do 4,552 inspections in a year if none of those inspections were followed on appropriately, or it was just sort of flyby? Are you really seeing an increase or a more protective environment?
So this kind of runs into my question was with the risk-based I know you all probably, because I've talked to most of y'all about this, but most agencies have some kind of a frequency in which they inspect. When you went to risk-based, did that change for those facilities? And did it also change for your lower risk facilities? Were you able to parse those back and focus more on the high risk facilities? Did your frequencies change? Mark, I'll let you answer that one.
So short answer is yes. You know, knowing that to do a quality risk-based inspection is going to take longer, that means you have the same amount of resources to do the same number of hours of inspections, but maybe not the same number of inspections, if that makes sense. So, you know, certainly we have to look at, you know, our expectations. So certainly we tried to adjust those frequencies to match what our resources that we had, we believed could execute. So, you know, some of the jurisdictions you hear about maybe 1, 2, or 3 or 4 times a year, we're really looking at, you know, a 3 to or longer year window to work on what our frequency is for those types of facilities. And some we're even looking at some of the facilities we do, we're looking at, you know, complaint based only,
Yeah.
those types of things. So I think we're always looking at, you know, the resources that we have aren't always in most cases aren't under our control,
Right.
but the execution of the you know, our work is under our control. So how do we best utilize those resources? So I think,
Yeah.
you know, we're looking at, you had mentioned data systems earlier, and I think we're looking at trying to crunch as much data as we can to determine, is there a better way to
Correct.
set an inspection frequency other than just based on
Months
kind
so
of this
far.
this 5-year, this 3-tier, 4-tier, 5-tier static kind of frequency. So I think there's more to come on that, but staffing levels are important to the point that you need to know what they are so you can certainly communicate expectations not only to your leadership, but also to your staff to let them know, hey, we don't expect you to get more done here, even though we're never going to run out of work. Here's where we're looking. We want quality inspections, and certainly there is going to be an expectation on the number of hours of inspections that you do, but we're not sitting here, you know, at the end of the day, we're not looking at your list and saying, hey, there's 10 places that you didn't get to this year. That's not what we're looking at. We're looking at what was the best use of your time.
Very good. And just one more question, if y'all can, before we run out of time, but we've noticed in some of our data analytics project that we're doing that the time of the inspection is critical. So have you all looked at that as far as when's, you know, I know it depends on the operation, but doing a risk-based inspection when they're just opening or they're on a break, or, you know, did you all make adjustments to your team's time within the facility to conduct a risk-based? Do you track that it's best to be here during the morning when they're doing prep or cool down or reheat, whatever? Did you want to answer that, Kim? Somebody had their hand up. I'm sorry.
Yeah, that was me. I do think it's absolutely critical, and we do struggle with that, especially if we're going into remote villages. We often fly into our facilities, and so, you know, we try and do as much as we can when we get out there. It can be quite expensive. Sometimes it's not the ideal time, but we do try to encourage people to look at the menus ahead of time, which is what Joe mentioned ahead of time. Do your review, figure and think about when might they be cooling, which we know is out quite a lot and is a more complex process. You know, think about those things and think about the particular facility and try to adjust your schedule. We say work with your supervisor to maybe work on a day when you normally wouldn't be, or work in the evening as opposed to the hours, those types of things. So I think that's a good point you bring up.
Okay. Mark, did you want to add to that quickly?
Yeah, real quick. I think to Kim's point, we're not always going to be able to choose. You know, ideally, you'd love to be in every place just before they're getting ready for a big lunch, right? Well, we have a lot more in our inventory. So I think what we've tried to do there is not only encourage them to look at their schedule and try and inspect places when it makes the most sense, where they're able to see the most. And we also don't want to be in there during their rush if we can avoid it. I mean, I think we want to try and not impact the facility negatively in any way that we can that makes sense. But I also think we try and train our folks to verify things that you can't see. Have those discussions, whether or not that process is occurring now or not. There's, there could be something in some stage of cooling that, we should be able to identify those things, and maybe our inspection becomes more discussion based than it is physical observation based, or certainly there's going to be a combination of both, but we need to be able to do verification of control,
Right.
regardless of whether those activities are occurring right now or whether they occurred 15 minutes ago or whether they're going to occur tomorrow. We still need to be able to verify control during any inspection.
Very good. Well, we're about ready to wrap up. I had several questions in the chat, but if there's any other questions that you all have that we haven't had time to answer, you can email me or any of the panelists. I'm sure you can get in touch with them, but I really do appreciate your time. I think it's been a great panel with some good suggestions and good ideas. I hope many of you on the call will take some of these back with you and incorporate. This probably won't be the last time we talk about risk-based inspections, because it is, I think, the wave of the future. That's just my opinion. Get away from the floors, walls, and ceilings. Not that we can't completely ignore that, because that's important too. But for our next calls, I hope you all will send me some ideas or future topics. We're always looking for that. As I mentioned before our next call, Amy, you can go to the next slide if you'd like. Our next call will be March 29th, which will be the risk factor study. Oh, I know what I wanted to do. I was going to pop into the chat. Hold on one second while I get it ready. I'm going to pop into the chat. I should have done this earlier. It's a link to a document that, through the collaborative projects, NACHO and CFP did a kind of an analysis of factors that influence the implementation of a risk-based inspection program. So hopefully you all can have time to copy that link down, but it's a pretty decent little document that they did some surveys and some key informant interviews of I believe it was mainly local organizations, local jurisdictions that and they kind of compiled that into this nice report. So if y'all are interested in reading that, I popped that link into the chat. That'll maybe help you answer more questions or glean a little more additional resources for the risk-based program. So as I mentioned, our next call is March 29th. We're going to look at risk factor studies, some of the angst and barriers, and maybe some tips on conducting those. And then May 4th, I believe our call will more than likely be about HACCP inspection process, the special processes, but I am very open to additional topics. And unless anybody else has additional questions or concerns or input, I'll let you all go. But I want to thank the panelists. Lori, thank you so much for joining us and giving us your welcome. And Steve, you're always such a great inspiration to me for these calls and for our team. So I hope someday I see a lot of familiar faces on this call, and I hope pretty soon that we get to see each other in person someday. But I think this is a great format to get us together and talk about things and feel connected. So I hope you all have a great rest of the day.
Thanks for having us. Take care.
Okay.
Thank you. Take care, everybody.
Thank you.
Thanks.
Bye.
Bye. Thank
Thank you, Amy.